Now, it wouldn't be a problem if for all that extra money we were getting a lot better quality of care. But the fact is, we have peaks and valleys of quality in this country. We have great academic centers like Jefferson, but we also have very uneven quality in this country. This is that most important health policy graph I told you about in a slightly different way. On the x-axis is the per capita expenditures in healthcare, so again, how much we're spending. The y-axis is life expectancy at birth, and again, you can see the United States is nowhere on the same planet as everyone else. We spend a whole lot and don't get that much in terms of life expectancy. Now, there are a lot of experts who would say you cannot look at life expectancy at birth as a measure of healthcare quality. Lots of other things that go into it. We try to save preterm babies. We do a lot more of it than other countries. They die, or they live a little bit and then die. Shouldn't really count that. I'm not sure why not. There's violence in our society. We're a more violent society. We shouldn't count that. I'm not sure why not. Lots of accidents in our society. Why don't we count those, whether we save people or not? In any case, you don't like life expectancy at birth. I got another figure for you. Life expectancy at 65. Preterm babies no longer count. Violence shouldn't count. Accidents really don't count. Turns out we don't do so hotsy-totsy at 65 either. If you hit 65, your chance of living longer, well, in the United States, if you're a man, you're 12th in the world. If you're a woman, you're 16th in the world. And by the way, for those of you who are keeping score, France is number 2. I got another figure for you. The RAND Corporation did a very, very important landmark study published in the New England Journal in 2006. They went to hospitals, looked at Medicare patients who were discharged, and assessed whether they got some pretty standard treatments, all of which were recommended because they had a big impact on health care. Things like, were patients' blood pressure measured, and if it was high, was it brought under control before they left the hospital? Cholesterol, was it measured? Was it brought under control before they left the hospital? If they came in for a community-acquired pneumonia, did they get a vaccine on the way out the door so they wouldn't return? Well, it turned out that we did that 55% of the time. No one can be proud of that number. When they redid this study for kids, it was even more shocking. Only 46% of the time was recommended care performed on kids, less than a flip of a coin. We cannot be proud of that in this country, and especially for all the money we're spending. Here's another example, adult asthma. Quality of care in this country is not what it ought to be. We have the second highest adult admission rate to the hospital for asthma. We're not doing a good job of controlling it out of hospital. And our mortality rate for asthma is 5th among developed countries. Again, nothing we can be proud of. This is not that complicated to manage. This is not like complicated chemotherapy or, if you're a surgeon, a Bill Roth 2 or a Whipple procedure. And then cancer quality. This is women and colorectal cancer. And again, what you see is maybe at some places we're doing fantastic, Hawaii. But there's a huge spread down to New York State here. 10 or 12% survival difference within the country. Again, some places we're just doing fantastic. But it's very haphazard and uneven in this country. And for all we're spending, the 40, 50% more than the next highest country. And then we know that the quality of care is heavily correlated with your insurance status. This is breast cancer 5-year survival, or survival times. And you can see you do much better if you're privately insured, and you do much worse if you're on Medicaid or uninsured. This is a terrible indictment, it seems to me, of our system. I'm a breast oncologist, and I think this is a significant embarrassment to us. And women are literally dying because of the way our system treats them. And then there's the fact that we have a lot of overuse, which adds, not necessarily so important. I might note that there are a lot of C's here. Knee replacement surgery, twice the OECD average. Is that because Americans walk more? Cardiac catheterizations, twice the OECD average. Cabbages, 1.4 times the OECD average. Cardiac stents, 1.5 times the OECD average. C-sections, 1.4 times. Do cardiologists do C-sections, by the way? Cataract surgery, 3 times. CT scans, twice. The United States has the second most MRI scanners per person in the world, and the most CT scanners per person in the world. So when it comes to high margin interventions, we do a lot more than the rest of the world.